Hi, I'm going to make a video here. We're talking about pregnancy massage, and what we're talking about is what points are contraindicated during pregnancy massage, which are the points that I'm going to show you, because a lot of the time they are overstimulating of blood. They overstimulate, not over, but they boost chi, they boost blood. It has a descending of chi and energy quality, which while you're pregnant, you don't want to be disturbing too much of the blood flow and the chi flow. It's always good to have a good chi boost. And so as an acupuncturist, there are great points to work with that are safe during pregnancy, which you can do to boost chi. But what you don't want is anything that's overly stimulating. And it's the same with aromatherapy. You're not going to overstimulate the nervous system or the circulatory system. However, I want to show you these points because these are the points that when I'm treating at around 38, 39, 40, depending on the lady, sometimes you want to wait till 40 weeks. But if it's a second or third baby and it's time to get this baby out, any time from 38 weeks is fine to do these points. So we're going to start with kidney 1. Now kidney 1 is on the ball of the foot, not the ball of the foot, it is the ball of the foot. It's just below in this natural depression here, and in reflexology it's the solar plexus point, and you can feel it because it has a very natural depression on this change where the ball of the foot and the colour changes. It's right in the centre there, and that's kidney 1. And then we're going to go to spleen 6, and spleen 6 is on the medial aspect of the leg, and you would come to the medial malleolus, and so you place your pinky on the high point of the medial malleolus and you do 4 fingers, and then you're going to come off the tibia. Oh yes, oh, that's a great point. It's a really good point. So this really helps to stimulate the uterus and the whole reproductive organs. It really helps to stimulate that area and will help to contract the uterus. And then we've got spleen 10, which we sort of joke as being the uncle point. It's the point where when you grab the knee and squeeze it, it almost gives you that sort of dead leg. But the way to find it is on the top, on this medial board, the top of the patella on the medial aspect. Again, you're going to put your fingertip on that medial, like the top depression here on top of the patella, and a whole handspan, and then you're going to press until you find that point where it feels that's almost like a dull ache, and then you know you've got it. Then we've got liver 3, and liver 3 is in this metatarsophalangeal joint. Oh God, I got that right. In this lovely depression, you can feel where the joint, it sort of then reaches like a high point on the metatarsals, but you just come down, you feel this lovely natural depression. Once you've found it, you can stick your thumb into that. The other thing, if you've got, let me show you, while you're doing acupressure, unless you're an acupuncturist, in which case you would needle it, you can get these from the Amazon. Or from the Amazon. The actual Amazon. They deliver them, but you can find these points and you could work with those and press those. So that's a way of working these points. Okay, the next point is, so bladder 67. Bladder 67 I wouldn't get involved with unless you're a qualified acupuncturist, but it's this point here really helps to turn breech babies. It's called bladder 67. It's on the lateral pinky of the nail bed of the little pinky, the baby toe. There's a point there, and you would never needle it. You would do it with moxibustion, but it's a great point if you've got a breech baby more than say 34 to 36 weeks and there's room to turn it. I've done that successfully with moxibustion, so that's a good one to know about. Okay, and then gallbladder 21 is in the midpoint between, I've got a video about some of these points, but there's the spine, and here's the acromion junction, and there's a midpoint right between it. It's called gallbladder 21, and gallbladder 21, you know you've got it when you've got it, because it goes, oh, it's a killer point, and it's right in the middle there. That's gallbladder 21. So when we're doing some of these techniques and massaging around the trapezius crest, you want to be really careful. You can sweep over that point, but you mustn't intentionally press it, because that has a very strong descending chi property. And then finally, I just want to show you a couple of reflexology points. This is the uterus here. So we avoid the uterus during reflexology until it's time to go, in which case it's a really great point. And here's the medial malleolus and here's the heel. Directly in the middle here, this is the uterus point. So you can really work. Oh yes, I can feel that as well. You know when you've got it because it's like a dull ache. So that's the uterus. So you would work very much into that. Oh yeah, that's great. And then there's also kidney 3 here, which is, I put the kidney 3 in, and it's more of an across rather than a diagonal. So there's the medial malleolus, and here's the Achilles tendon. Right in the middle of that, that's kidney 3. That's a great point. It boosts kidney energy. So again, when you're ready to deliver, you want really strong kidney chi. And it really helps to bring the baby. I'm slightly dehydrated there actually because that's showing a depression. This side is the ovaries rather. So you can also work on this. You can work them bilaterally, but here's the lateral malleolus and the heel. You can come right in the center there. That's with the ovary. So this just works all of the reproductive system. And then you can come over the top here by the talus. This is the fallopian tube. So although we're not necessarily working with menstruation and ovulation for the reproductive, it's good to just massage this whole area here if you're doing a supporting for labor. I wouldn't necessarily, say it's an induction for labor. I think that people get high hopes, but you can certainly preparation for labor. This would be a really good addition to your massage practice. So if you've got any questions, you can comment below or get in touch with me at the School of Fine Tuning. And it's Anna Jyoti Low. And yeah, thank you so much for watching.